2024 kicked off with the highest number of drug shortages on record. The American Society of Health System Pharmacists says there were 323 active medication shortages in the first 3 months of the year. Back in February, a doctor with one of the largest cancer care facilities in the country told Congress what this means for his profession.
In a country that offers the most advanced cutting-edge cancer therapies, we were put in a situation that a decade of medical training did not prepare us for. The moral dilemma of how to ration our limited supply of these chemotherapies.
CBS News reporter Erica Brown has been on the phones reporting out this story, and she joins me now to tell us what she found. Erica, good to be with you. Thank you for doing this work. Why? Well, let's start with which drugs are in short supply first.
Yeah, and John, as you mentioned, it's a record number of drugs currently under shortage right now. So what drugs are we talking about? We're looking at 5 classes of medications. That includes central nervous system stimulants. Now, those could be used for pain management or neurological disorders, especially those like ADHD. We're looking at injectable chemotherapy. That could be used for cancer patients and their treatment. We're looking at hormone therapy and also antimicrobials. Antimicrobials are sometimes used to treat life-threatening infections. They include antibiotics and antivirals and also electrolytes and fluids. So you go to the doctor, you go for a medical procedure, you need an IV, you need those fluids. So a wide range of drugs currently under shortage. And speaking to medical health professionals today, they tell me among those classes, what they're seeing is that those medications used to treat ADHD are among the most widely impacted when we look at the number of patients affected by this. John, that can be extremely disruptive to people who need these medications and their ability to function and work, home, school. So those medications, I think, have the highest number of patients currently that are directly impacted. But overall, we're looking at a wide range of drugs under shortage.
That is broad. So why is this happening?
It's a complex system. It's like a perfect storm of high demand, supply chain disruption, and also a very complex drug marketplace. So we're looking at high demand. For example, you know those diabetes and weight loss drugs that are very popular right now. Surge in demand sometimes can mean a shortage in supply. Looking at supply chain disruptions, that could be geopolitical factors, it could be environmental factors, especially for drugs that are manufactured overseas and some of the sourcing and raw materials that come from overseas. That can be very easily disrupted. And then look at the marketplace. So you have generic drugs, John, that are priced so low. Manufacturers are not incentivized to invest because the profit margins are low. So sometimes you have manufacturers that leave altogether, and you're left with fewer manufacturers that are left to handle a high supply, high demand.
So if there's only one manufacturer and it gets wobbly because of some other thing, now you're out.
Right.
What's being done about all this?
Well, you have the Biden administration, the Department of Health and Human Services. Just this month, they laid out policy recommendations to help incentivize manufacturers to get back in the game and to invest in some of the supply chain management and also in production stateside and sourcing raw materials stateside. They also look to incentivize hospitals to bolster their own supplies. And they're also looking at diversifying manufacturing so it comes from multiple sources and market transparency.
Erica Brown, that's a lot today.
It's a lot.
And you were working those phones. Thank you so much, Erica.
You're welcome.